Mr. Mitchell.
Thank you. I'd just like to comment on the library issue. The libraries, the funding is totally in place for both those libraries, at Stapleton and Manus Harbor. The construction is scheduled to begin in June of 2009. We have a commitment from the New York Public Libraries. And the mayor, you heard in the State of the City address, took credit for Councilman McMahon's library, much to his chagrin down in Washington. Also, the mayor announced that the 120 precinct is going to be built and the 121 precinct is going to be built. In fact, those are the two of the shovel-ready projects that he wants to begin this year. That being said, listen, HHC, no doubt, should provide the same services it provides in the other 4 boroughs to Staten Island. That is something maybe we should look into do legislatively, like we did when we put a nurse in every school and when we increased ferry service for the first time in over 3 decades. We did that legislatively. We started a debate, and that is something, if I'm elected councilman, I'll work with my colleagues in Albany to see if we can bring about. I agree with Debbie Rose. We need to expand and we need to continue the Staten Island Health Access Program. That is one of the things HHC actually did for Staten Island over the last couple of years. It's been a tremendous success and needs to be continued. With regard to building a new hospital, I called the heads of both hospitals today to get some facts. And I was told that Staten Island University Hospital is licensed for 714 beds. And RUMC, Richmond University, is licensed for 510 beds. And of that, 200 of them are offline. They're not active beds. And generally, the census at RUMC of 450 beds, only 380 beds are active. So clearly, we don't have a bed problem on Staten Island right now, but we do have a problem with getting access to preventive care and diagnostic care. As you know, HHC, working with Councilman McMahon and our other elected officials, opened up a healthcare clinic on Port Richmond Avenue and renovated the Manus Harbor Healthcare Clinic in Manus Harbor. And right now they're looking to open one at 155 Vanderbilt Avenue. We need more of these clinics, and then also, it's not only getting the clinics. A lot of folks just run to the emergency room because that's what they think. What we have to do is provide outreach to the people in the community and let them know these facilities are available, and that'll decrease the burden on our emergency rooms. Thank you.
Thank you.